Joel Embiid is unfortunately once again injured, this time suffering a left shoulder sprain against the Cleveland Cavaliers earlier this evening. Welcome back everyone to your number one source for everything related to sports injuries and sports medicine news. Tonight we're going to be talking about Joel Embiid's left shoulder sprain. As usual, we'll take a look at the footage of the injury and go through the mechanisms of what might have happened here. We'll talk about the relevant anatomy and then some general characteristics of shoulder sprains and talk a little bit about general return to play guidelines. Please go subscribe if you guys like learning about this type of content and want to stay up to date with my future videos. And let's jump right to the footage of Joel Embiid's injury. The play occurred here towards the end of the first quarter when Embiid was getting ready to receive an entry pass, trying to post up down low. It doesn't look like much right away, but we can tell Embiid is in pretty significant pain grabbing at that left shoulder. Going through this step by step, we can see Embiid getting ready to position himself to receive an entry pass down low on the block. And as he's coming through, he extends out that left arm here like he's getting ready to sort of get that post position and kind of wrap around the defender. But then as the defender comes in, you can see he makes contact directly right here into the side of Joel Embiid's left shoulder. As we'll talk about later on, that specific mechanism is a lot of what relates here to the risk of a shoulder sprain. In this specific frame, we can see Embiid's left arm is kind of tucked in, and the defender is applying that axial load directly into his left shoulder, which is going to put him at risk of these shoulder sprains. The official word from the 76ers at the time of posting this is it's a left shoulder sprain. Remember that sprains involve injuries to the ligaments, whereas strains involve injuries to the muscles or the tendons. So this tells us that the 76ers suspect he has an injury to some of the ligaments in his shoulder. As you might expect, there's quite a few different ligaments that we can see in the shoulder. Ligaments are named for the bones they connect, and so here in the shoulder, we have a lot of different bony structures that are supported by the ligaments. What's more relevant to this particular case are the ligaments that we see around the AC joint. AC stands for acromioclavicular, so it's the joint here between the acromion, which is part of the scapula, and the clavicle, which is that collarbone here in the front of the chest. There are also some sternoclavicular ligaments where the clavicle attaches over closer to the sternum, and so we always have to think about those as being potential sites of injury when someone has a shoulder sprain. We of course wouldn't think of the joint right here by the breastbone being part of the shoulder, but a shoulder sprain could also be an injury to these ligaments. This is like what we saw happen with Tyreek Hill earlier in this NFL season. By far and away the majority of time when someone says shoulder sprain, they're talking about an injury to the AC joint ligaments. This would also be called an AC separation or a shoulder separation. There's three ligaments here around the AC joint. We have the acromioclavicular ligament between the acromion and the clavicle. We then have the coracoacromial ligament and the coracoclavicular ligament. All three of these ligaments are really important in maintaining the different stability patterns within that joint between the clavicle and the acromion. The most common mechanism in which we see injuries to the AC joint ligaments is when someone has what we call an axial load directed right into the shoulder. This commonly happens when someone falls on the ground with their arm tucked up underneath them, or happens when like a hockey player gets checked into the boards with their shoulder leading into that contact. Whenever that load comes in from the side and hits the shoulder, it directs all of that force in through that AC joint. And just like you can jam your finger, you can essentially jam that AC joint where you get damage and separation of those ligaments because of that force that's coming into the shoulder from the side. If we go back to the play here with Embiid, we can see that that's basically what happens. He's got his arm tucked in as he's trying to reach around to get position on the low block, and the defender's force goes directly into his shoulder, applying that axial load that would stress his AC joint. Now, watching this mechanism, there are other things we have to consider and other things that the 76ers will evaluate for. A shoulder sprain can also mean injury to those ligaments between the humerus and the glenoid, but that would be much less common. As I said, you can also have injury to the sternoclavicular joint where the collarbone comes over to the breastbone, but just based on what's more common and where we saw Embiid grabbing at the top of his shoulder, I would have that lower on the list. This type of mechanism can also concern us for a possible shoulder subluxation or any injury to the labrum. If you think of how Embiid has his arm kind of outstretched and then gets hit from behind and kind of inward, that can put a little bit of posterior or back to front load on the humerus, which can cause some shearing within the shoulder joint and a potential injury to the other soft tissues. But since an AC sprain is the most common scenario here, let's talk through how we classify them and what the sort of return to play guidelines might be. There are 6 specific types of AC separations, but for practicality purposes, we really often just think of the first 3. Type 4, 5, and 6 are much more severe injuries that always require some sort of surgery and are a lot more rare to occur, especially in something low impact like what happened with Embiid. A type 1 AC joint injury is whenever there's just been some microscopic sort of tearing and smaller injury to the acromioclavicular ligament, but no real tearing or separation where we can see displacement of those structures. Type 2 is when there's been complete rupture of that AC ligament, and now we do start to see some widening of that AC separation space. Type 3 is now when there's also been complete tearing of the corticoclavicular ligament. So now you can see in this situation how unstable the clavicle is going to be. There's no attachment out there at the end by the shoulder, and so it's a lot more unstable and it's a lot more serious. Type 1 and Type 2 injuries are treated non-operatively with just rehabilitation. The return to play in these injuries is often on the order of just a week to a few weeks. And then when you get into Type 3 injuries, it's a little bit more of a gray zone in terms of whether or not surgery is needed, or if you just go a conservative route. These injuries are more severe and their absence is usually longer than a few weeks and can extend over a month. We'll often try to treat these Type 3 injuries without surgery, but if they fail conservative management, then you'll have to go on to have surgery. By now, the 76ers have done x-rays, and so they have a rough idea of if there's any severe displacement between the clavicle and the shoulder blade that could signify a more severe injury. Keep in mind too that there are other less common things that could be defined as a shoulder sprain, and so we'll have to await more information from the 76ers medical staff before we have a full idea of just how long Embiid might be out. If this is a simple Type 1 AC sprain, then I would expect him to be out for somewhere around 1 week to 3, maybe 4 at the most. Thank you as always for watching the video, everybody. Let me know any questions or comments you have below, and I'll see you in the next one.